Welcome back to part 2 of a 4-part series from Med Evidence, Truth Behind the Data. Topic today is longevity. Can medical research help us live longer? Great question. Dr. Michael Koren, founder and CEO of ENCORE Research Group and a practicing cardiologist, is here today, and he has been a principal investigator of over 2,500 clinical trials and published extensively in the most prestigious journals in the world. Our other guest today is Dr. Victoria Helow, a very well-respected pediatrician and clinical research investigator, also practicing in the emergency room. Dr. Helow, you're a very busy lady. And so hopefully that helps with your longevity as well as staying busy.
Well, maybe. I need to slow down.
So we're talking about this simple formula. It sounds simple enough, Dr. Koren, about maximizing longevity.
Yeah, it reminds me of one of those jokes about going up to the mountain and asking the guru about the secret of life. And the guru says, avoid hazardous things, maximize healthy lifestyle, and discover the relevant medical evidence and apply its wisdom.
Easy enough, right?
There we go.
Where do we get this?
That's the punchline.
Yeah. Where do we get these rules on how to do these things?
Right.
So I guess we can dig in a little bit. We talked about avoiding hazardous things in the last show. So let's talk a little bit more about maximizing healthy lifestyle. So the cornerstones of that, of course, are diet and exercise. And if you look at exercise, you'll find that the most important thing is to do it regularly. It doesn't even matter what you do. Mm-hmm. If you like bike riding, that's great. If you like walking, that's great. If you like dancing, that's great. If you like gardening and you do it vigorously without stopping, that's terrific too. So lots of different activities, but the important things, and this has been shown in medical research, which is number 3, is that it's important to do it at least 2 hours a week. And that if you do it, you should do it in sessions of 20 to 30 minutes without stopping.
Continuous.
Yeah, and those are the key things. So if you hit those parameters, you actually live longer. Mm-hmm. There's studies that show that you live longer. Now, what's also interesting is that when you get, to 2 to 3 hours a week, then you get pretty much most of the benefit of physical activity. If you exercise 100 hours a week, you're not going to live any longer than somebody that exercises 3 hours a week. Mm-hmm. And in fact, there's some suggestion that people that over-exercise may be overdoing it and not necessarily doing the best they can for longevity.
Yeah, I was wondering about the over-exercisers. You do see the people who are out there an hour a day, every day, 7 days a week without a break. Don't you need a rest?
Our bodies absolutely need rest. And so the key take-home message there, and it's very applicable, and again, this is the wisdom of medical evidence and medical research, is that you need to create an exercise pattern in your life. You need to get it in your schedule. So what I tell my patients is that see if you can get 30-minute blocks 4 times a week. If you're working during the week, pick 2 nights or 2 mornings in the week where you'll get to the gym or get out for an early walk or get on your bike, and then use your weekend days and make that part of your schedule, and make that a part of your schedule that doesn't change. Mm-hmm. That people understand is something that you'll be doing on a regular basis, and they'll start to respect that, and that'll become your time.
Can a weekend warrior type of person live longer if they're doing 2 hours on a Saturday and 2 hours on a Sunday and nothing Monday through Friday?
I'm not sure that the exact research is out there, but it's worth a try. I tend to tell my patients just the opposite. Why don't you just take a 15-minute walk away from home and come back, and you're going to get your 30 minutes in? Don't let yourself sit down and look at Facebook on your phone or play a game on your phone. Do that 15-minute walk safely on a sidewalk and come back so that you've got your 30 minutes in and you've gotten through most of Facebook by then. Depends. I don't know. Some people have so many friends it takes them 2 hours each day to get through that. But again, it's sometimes easier to bite it off, as you say, and thinking about going 15 minutes away from home and walking back 15 minutes.
The evidence is that doing it regularly is important.
Mm-hmm. More than just a bunch on 2 days.
Yeah. Is there a difference between men and women? I mean, is there...
There is a difference between men and women, yes.
Yes. Let me rephrase. As far as their exercise...
Last time I looked.
Their exercise times or amount or what they're doing. I mean, is a woman going to live longer if she works out 5-6 days a week, or a man? Is there a difference?
Exercise benefits both sexes.
Okay. And
probably to an equal degree. But women live longer than men, and that's something we can talk more about in subsequent conversation. But basically the advice for exercise is simple but sometimes very difficult to achieve because of scheduling. We're all busy, we're a little stressed, and sometimes we do things other than exercise to deal with those issues. So again, I just advise my patients to get it in the schedule and to do it at least 4 days a week. And ultimately, your goal is between 2 to 3 hours of continuous exercise in sessions that are at least 20 minutes long.
Regardless of your age?
Again, like you said, 4 days a week is a better way to do it for shorter periods of time than cramming it in into just 2 days, because again, you get into that 2 hours of vigorous, you're going to start seeing maybe some of the negative effects of overusing.
Yeah, and I try to keep it simple, but really reinforce the importance of doing it regularly. And you learn from your mistakes. I had one patient who I told it'd be a good idea to walk 5 miles a day. Why don't you do it for the next 10 days and then get back to me? And the guy says, hey, he calls him back in 10 days. He says, hey, doc, I'm 50 miles from home. Now what do I do?
Oh, you just kept going. Nice. It's like, take a Uber back, you know?
And that was the end of his program.
Right.
So talking about the Maximize Healthy Lifestyle, are there any things that are associated with the risk makers?
The risk factors?
Markers.
Risk markers.
Yeah.
Okay, yeah. So that gets into something that's really interesting, is the concept of a risk factor versus a risk marker. So a risk marker is something that's associated with a particular medical problem, but not necessarily the cause of it. A risk factor is something that's the cause of it. And then you have risk factors that are treatable and risk factors that are not treatable. So a risk factor, for example, that's not treatable is age. And of course, the older you get, the higher your risk for a heart attack or a stroke or some other undue health event.
Falling off the ladder because
Falling
your balance is off.
Right.
Absolutely. And so we consider that a risk factor that cannot be modified. And the other things, cigarette smoking is a risk factor that has been clearly documented to be associated with heart attack and stroke and peripheral arterial disease, and that's modifiable. So you can stop smoking and that gets better. And that's also an example of avoiding hazardous things, is to not smoke. So that is considered probably the most modifiable risk factor at all, though for some people it's really, really difficult. But what do we do in terms of medical evidence? We actually do studies that look at helping people stopping smoking. And there are different strategies to helping people stop smoking. So for example, some people are very highly addicted to nicotine. And as it turns out, nicotine isn't really the bad actor. Nicotine is a chemical that makes people feel good. It raises dopamine levels in the brain, but it doesn't necessarily cause the disease. What causes the disease is all this garbage, all these chemicals that you inhale when you combust tobacco. So when you burn tobacco, you release 3,000 carcinogens and all of the crap that gets into your system, and that's the bad guy. So some simple strategies for helping people stop smoking is, okay, you can have your nicotine. We can give you the nicotine in a bunch of different ways, but just don't smoke. And a lot of research is looking at that in different ways. And then the other way of looking at that is to affect the brain. So if your addiction to nicotine is basically craving this dopamine surge, can we give you that dopamine surge in other ways or prevent the addictive qualities of those dopamine surges? And we're doing that research as we speak. So if people are interested, they can certainly give us a call and get involved in this type of work.
I think that's fascinating, especially when you're saying, is vaping, and I know that vaping is not a replacement for smoking, but is there a misconception there that people are healthier because they're vaping and not inhaling the tobacco?
Yeah. Well, there's actually debate amongst physicians on that point. Some public health people just don't like the idea of smoking in any way, shape, or form. They rather give the nicotine through the skin or by chewing it or other ways. Others like me, I'd rather see somebody vape than to smoke cigarettes. And obviously, I would like to see them take nicotine in other ways better. But if for whatever reason they're willing to go that step, that's better than no step. The other part of vaping is that sometimes the vehicle in which the nicotine is dissolved can have toxic effects.
Yeah.
So we've heard these issues with popcorn lung and other types of complications of the actual vehicle that the nicotine is absorbed in. So a lot of public health people have concerns about that.
Okay. All right. Another thing about risk factor, you mentioned age. And, are we talking about chronological age or the biological age?
So I don't know if you want to jump into that a little bit.
Well, the chronological age is definitely a risk factor. And with that chronological age, unfortunately, we also do have an increasing biological age. The chronological age we cannot change. We're stuck with that. The day we were born is the day that marked when we were going to start chronologically aging.
Well, my mom has been very successful at changing that on her driver's license.
Age is just a number, just a number.
But biologically, yes, that is a huge difference between the two in many people, and that's exactly what we're talking about. Let's change our biological age for a better quality of life, so we do have better balance, and we do have better heart, and we do have better skin and brain health, etc., so that we are feeling better, not just chronologically aging and feeling the biological effects of that chronological.
Yeah, and I jump in and just say biological age is a little bit of a marketing gimmick. So, conceptually, it's just, are you in good shape?
Yes.
So that's your biological age. If you're in good shape for your chronological age, you have a lower biological age. But to say that there's some number that we can test your cell and tell you, well, you're only 40 years old. Well, Doc, I'm actually 30. Oh, excuse me.
Can we reverse aging?
So these are concepts. There's some discussion about telomere length on cells. Telomeres are part of your DNA type thing, and whether or not that is an indication of your biological age. And they're interesting theoretical constructs, but honestly, it doesn't necessarily apply to anything. And you can't go out and test your telomeres and say, oh my God, my telomeres are short, I'm doomed.
But haven't they done this in some of the studies and tested this?
Not in humans.
Oh.
So this gets into the whole concept of different types of medical evidence. And remember, in our third point, it's the relevant medical evidence. So there's a lot of theoretical stuff that's really, really interesting. It's fun to read about, but can you apply it to the day-to-day? So, as Vicki mentioned in the first segment, longevity is hard to study because it takes a long time in humans, but you can study it in rats and in other species. And the question is, whether or not what we do in rats is really relevant to human beings.
Well, it might be in, New York.
Well, I'm a New Yorker, so I can say that.
And I can say it because I know you.
But outside of New Yorkers, I'm not sure rat research is relevant to human beings.
Right. Yeah, that's interesting. Is money associated with longevity?
Great question. The answer is yes, but not in a linear fashion. So for more affluent countries, you tend to live longer. And even if you have similar genetics. So a good example of that is one of the places that has the longest life expectancy in the world is Hong Kong. It's part of China. And the people in Hong Kong are genetically very similar to the people in other parts of China. But people in Hong Kong, on average, live 10 years longer than people in China. And that's because Hong Kong is a very developed city and city-state with a sophisticated medical system, a sophisticated and educated population, and they tend to take on more of the healthy lifestyles, and they live longer than genetically similar people. On the other hand, you don't have to be super rich. So going from middle class in an affluent country to rich doesn't necessarily increase your longevity. And one of the interesting examples of that is actually the Hispanic paradox. So if you look at data in the U.S., you find that the ethnic group that lives the longest is actually Asians, and Asians actually have the highest income in the U.S. And then Caucasians are kind of in the middle. They have middle life expectancy and middle average income. Blacks tend to have lower income and lower life expectancy, but interestingly, blacks in affluent places live just as long as the whites. Mm-hmm. But the Hispanic population is particularly interesting because the Hispanic population has a lower overall income than Caucasian, non-Hispanic Caucasians, but they live over 3 years longer.
They are very happy people.
Maybe
family.
I think diet has a lot to do with it. Yeah,
Mm-hmm.
I think diet has a lot to do with it. Instead of eating fried foods and bacon and the good old Southern diet, they're eating rice and beans and other things that are much more healthy and more of a Mediterranean style life. Mm-hmm. And we like to discuss Mediterranean style eating. I don't know if you want to jump in on that a little bit.
Yes, I mean, we do know the Mediterranean diet is associated with longevity. We have the Blue Zones research that has been done and been fascinating. That was study that was done with the oldest living people. And the high fruits, high vegetables, very little meat, and of those meats they tend to use fish primarily, and the association with vegetables with fish has been shown to dramatically decrease your risk of heart disease, which is still the #1 cause of death worldwide.
Yeah.
Yeah, I'll make a big pitch for fish. Fish has actually been studied in clinical research. And one of my favorite studies is called the DART study. In the DART study, which was done in the UK where they didn't have a whole lot of money to do the research, they simply randomized people to eat fish at least 5 times a day. Just advice. They didn't actually monitor the diets. They said either eat fish 5 times a day, eat low fat, or eat high fiber. And the people that ate fish after a heart attack had a 20% survival advantage. Just the advice of eating fish. So that's fascinating research, relevant research, and easy to apply to our day-to-day life.